welcome to this talk. And Dr. Sunil Dand, thank you for coming back.
John, it's great to be back again. Looking forward to a fruitful discussion.
We hope so. Now, this series is called Natural Medicine, where we look at alternatives to mainstream pharmacological interventions, things in lifestyle that can make us healthier, and natural therapies that maybe were known about from generations past that have been forgotten about. Now, the key thing is that I'm presenting today and Sunil does not know what it is. It's a secret.
No idea. I'm learning like the rest of you, and that's what we want you to gain from this as well, that this is an organic discussion and you're learning and I'm learning in this particular episode as well. And I'll be interjecting with questions and we will have a flowing discussion, I'm sure.
We hope so. We'll wait and see. But the key thing is that Sunil and I are allowed to ask each other questions. Now, so far, Sunil has answered my questions with ease. I've just about managed to draw out answers to basic answers to his questions so far, which of course could mean we're asking each other questions that are too easy, Sunil, do you think?
I think so. And I'm going to try and stump you today.
Good.
The bad side of me is wanting to stump you. In front of all these viewers, let's stump the great Dr. John Campbell.
if only. Now, just before we start, I'm going to be taking a supplement of iodine. Now, this is iodine formulated by Dr. Lugos, who was a French physician, and he formulated this back in the 1820s. And he thought there was also a saying then in old medicine. It says, if you know not the where, when and why, give ye then the K and I, which is the potassium and the iodine. So I'm just going to take a drop of this, my dropper, as my drop of iodine. I'm going to dilute this in some ordinary tap water. And you can probably see we've just got a very light coloured solution there from one drop. And it tastes a bit like swimming pool water.
Interesting.
But of course there's a reason for that. Iodine is in a group of chemicals in group 7 of the periodic table called the halogens, which contains chlorine, so it's not surprising that it's similar. And we'll see it also there's other things as well that can interact with iodine in the body. Now, if I mention iodine deficiency to you, Sunil, what's the first thing that would come to mind?
Like a goiter.
Yeah, which is?
Yeah.
What is it?
So it's basically your massive. It could be massive swelling in your neck due to iodine deficiency, and this used to be very common back in the day. Now, not common, especially in our parts of the world.
Yeah. Now, there was quite a lot of goiters occurred in the Midwest in the United States back in the 1920s. And doctors realised that this was caused by iodine deficiency. So what they did was they supplemented iodine, and they found that if they gave 150 micrograms of iodine, that was enough to get rid of the goiter. The goiter would go with a very small amount of iodine supplement. Now, I've just taken there about 6 or 7 milligrams of iodine in that one drop. Now, of course, we're not advising people to take any particular.
No,
we don't prescribe on this channel. That's what I took. So interesting that the recommended daily amounts that we have now are often based on these historical ideas where you give the minimum amount to get rid of a pathology. We have much the same with vitamin D, where a very small amount of vitamin D will prevent rickets, but there's many other things involved as well. And I've found out the actual research that I want to do today is on breast cancer.
Oh, okay.
And breast cancer particularly that presents late. So I want to come on to that, but when I started looking at this, it was so interesting. I've discovered, and I didn't know this, I should have known this really, but over a third of the global population is iodine deficient to some degree.
Wow.
Quite incredible.
And is that mainly in eastern countries, certain regions of the world, or is this spread uniformly?
It's mostly in inland areas away from the sea, particularly mountainous areas. Now, in my country, your granny would have told you something about Northern Ireland neck or Derbyshire neck, where people in these areas away from the sea had the goiter, as you have already described. But people in mountainous areas that are a long way from the sea, and the reason for that is virtually all iodine comes from the sea. So people that are living by the sea, they might be eating more fish, they might be eating seaweed. And in England, as you'll probably know, that it was a tradition in many rural areas to go down every high tide and pick up all the seaweed and take that into the soil as a fertiliser, because it's an excellent fertiliser and that will put iodine back into the soil. And also, you know, when you go down by the sea and you get that bracing sea mist that smells really nice, that contains iodine. So people by the sea get a lot of iodine, but people inland don't. And this is really quite a common problem. And I've also found out, and this is quite well evidenced, that iodine deficiency is the most common global preventative cause of mental impairment.
Really?
Yep.
Still today. That is fascinating.
Yep. Now, of course, we've known for, probably about 150 years that severe shortage of iodine, and it's not a politically correct term now, but if a child is very short of iodine, either in the uterus or after birth, it causes a condition we call cretinism. I guess these days we'd call it pediatric hypothyroid syndrome. But it just shows how essential iodine is for the development of the nervous system.
Absolutely crucial. Yep, we learned that in medical school very quickly.
Yep. But again, people tend to think that if you give a small amount of iodine, you're not going to get overt cretinism. And people with cretinism were characterized by stunted growth, abnormal facial features, failure to develop sexually, and severe, well, in those days it was called mental retardation. Now, of course, we'd call it learning difficulties. But the question is, does subclinical deficiency of iodine cause reduced IQ? And the answer to that question is yes, it does.
Yeah, makes sense.
It's known that people that are somewhat deficient in in fetal life and early childhood life, that are somewhat deficient in iodine, although it's not enough to cause overt cretinism, and they'll develop physically and they'll develop sexually, can still have a reduced intelligence. And I look at areas inland. For example, I do some work in inland Uganda. It's a long way from the sea. And I really wonder where those people get their iodine from. And I really wonder if iodine supplement could potentially transform the next generation. I mean, do you think I'm taking this too fast, Neil, or does that kind of make some sort of
everything
sense?
you say is very logical indeed. And as always, with any natural discussion, we have to go back to basics as well and say, okay, well, here we are as a human species. We've been on the planet for hundreds of thousands of years. You would assume that humans naturally at some point were in a place where they were receiving adequate amounts of iodine, and that's how humans continued to propagate. And did we somehow move away from that, or did something else change in the environment that people are getting less iodine than we are designed for? That would be my kind of core thought right at the beginning, just taking everything back to bare basics.
Mm-hmm. And there's another old saying in areas like Cornwall and Devon in this country that when the tide is out, lunch is served. So you can go out, you can pick some seaweed. Virtually all seaweeds are edible. And you can go out and pick shellfish. And when people migrated around the planet, a lot of early migrations were round about the coast for that simple reason. The availability of shellfish and foods like that. Yeah. And these foods would be high in omega-3s. And they would also be very high in iodine. Now, which country springs to mind when we think about people that eat plenty of iodine in the diet?
Well, I would think, and I can see where you might be going here. You would think that countries with coastlines, with well-established towns and cities around those coastal areas, possibly warm weather playing a part as well. So if we're thinking Mediterranean, Japan, fascinating. So yeah, maybe this also accounts for some of those great health outcomes we see in those countries. In
the Mediterranean diet, absolutely excellent point. And there's also cultural factors, of course, in food. We tend to like the food that our mothers fed us when we were young.
Natural.
You know, my Indian friends go home and the mum makes them a biryani and they're delighted. You know?
Anyone of Indian origin knows that feeling.
Having said that, I love a good biryani myself, of course.
Well, we had some great Indian food, remember, in London?
We did, didn't we? Yeah, when we were at Aseem Malhotra's first Do No Farm film, which was quite excellent. Japan and Korea have got a very strong culture of eating ocean-related foods. Eat a lot of fish, of course, but particularly high in iodine is sea vegetables, seaweed and kelp. So if you eat a meal of kelp salad that I often have when I go to Japanese takeaways and things, that's probably going to contain about 12 milligrams of iodine.
Okay.
Very large amounts of iodine. And the classic study here, of course, we've known for generations that the breast cancer incidence in Japanese women is very low.
Yeah.
What's the breast cancer incidence like in the United States?
It's probably very similar to the UK, and sadly we're seeing dramatic increases. I hear lots of anecdotes all the time. It's horrible, but it's going in the wrong direction. Yeah.
And this paper actually reports that in young women in the United States, there's an increase in breast cancer with distant involvement, with metastatic involvement, presenting at a late stage. So just sketch out for us, if you don't mind, Sunil, the difference between a primary tumour and a secondary metastatic tumour.
Yeah, so to back up a little bit, because I think it's important to remember, and I always stress this as a doctor with an interest in metabolic and immune health, what is cancer at its core? It's undivided cell growth. And a lot of people don't fully realize that cancers are forming all the time in us, all the time, every day. And our immune system immediately picks it up and will kill off those cells. Abnormal cells have no business in our body. And unfortunately, that natural process of clearing up all these unregulated cells which are dividing sometimes goes wrong. And when you have uncontrolled cell growth, that essentially is a tumor right there. It's a mass of cells just completely out of control, and they continue to grow. That would be the primary tumor. Where cancer often becomes deadly is those cells which are uncontrollably dividing. Just picture it in your mind. They will start breaking off and they'll start spreading, and they'll go to nearby places. They'll go to lymph nodes and they'll spread locally, which would be an early stage cancer, or they'll go to distant places. Maybe a cancer lower down goes up to the lungs or to the brain, and that's what we call distant metastases. And when these cells just continue to divide, eventually they cause so much inflammation, if this isn't cured, that all those local areas just start to fail. And that's essentially why people die of cancer, in a nutshell.
So it's like a seeding effect, really, isn't it? The original tumour becomes a lump. And that's all a tumour means, really, isn't it? A lump.
Exactly.
Because one cell piles on top of another, and they just shouldn't be there. And then they can seed and they can spread around. And I think one of the things with cancer cells is normally our cells stick together. So your skin doesn't rub off because the cells are all stuck together. But cancer cells lose these adhesion molecules.
They do.
And can just float off.
Just go.
And you can go and see the best surgeon in the world, and he might cut out one tumour. But if you've got hundreds of little tumours all over the place, not much can be done about it. And this is part of the problem this paper's pointing out, that a lot of younger women are presenting that have already metastasized. therefore have a really bad prognosis. But we've known for a long time that the incidence of breast cancer is way lower in Japan. Now, the reason we know this is, of course, after the Second World War, there was tens of thousands of young American men stationed in Japan, 1945, 1946. And of course, the inevitable happens. They married a lot of young Japanese women and took them home. Now, the Japanese women in Japan at that point and now had a very, very low rate of breast cancer. Very low rate, maybe hundreds of times lower than in the States. But these young women that maybe left Japan in their 20s, by the time they got into their 50s and 60s, their incidence of breast cancer was kind of halfway between their sisters that they'd left in Japan and women that had lived in the United States all the time. But their daughters of these women, who were in utero in an American environment, who were brought up in an American environment, their rate of breast cancer rose to the same as those that had lived in America for generations, indicating some environmental factor in the difference in iodine intake. So it's been estimated that in Japan, different studies say different things, but the ingestion of iodine in the United States is probably, in most people, not more than a couple of hundred micrograms per day. In Japan, it's probably at least 2 milligrams per day.
Way more.
So at least 20, 30 times more. Some studies show an average of about 6.5 milligrams per day from eating fish and seaweed. And other studies in some areas show even higher, 10, 20, 30 milligrams of ingestion of iodine a day in some areas in Japan. So it's a very interesting variable. Now, the interesting thing about iodine is that if someone's iodine-replete, if there's enough iodine in the body, then you'll just excrete in the next 24, 48 hours, 90% of what you take. So although it's hard to measure iodine in the blood, we can gauge how iodine deficient someone is by how much they're excreting in the urine. So most people in the United States and the United Kingdom, if you give them iodine, they'll only excrete a small amount of that in the urine over the next 24 hours, indicating that the body's trying to suck the iodine up, that it's trying to keep, the body's trying to keep the iodine.
Yeah.
Now, of course, every person, every school boy or girl who's done biology knows that the thyroid needs iodine. But I wasn't as clear that the iodine is needed for all glandular tissue in the body.
Makes sense, yeah.
So people, for example, that don't have a very low in iodine don't sweat because the sweat glands don't work properly. It's needed for normal function of the salivary glands. But also, of course, the breast is largely glandular tissue, as is the pancreas. The ovaries are also iodine dependent, and so are the what's that gland in men that makes the seminal fluid? The prostate gland.
Yeah.
Senile moment there. So, and all of these cancers, prostate cancer, breast cancer, prostate cancer, of course, is by far the most common cancer in men.
Yeah, by a long way. Yeah.
And they're all associated to some extent. Well, they all require iodine for their normal physiology. So it really makes you wonder if iodine deficiency is a big factor in breast cancer and prostate cancer.
It does. And what I really am fascinated about when you present evidence like that, so again, coming back to my interest in metabolic health, people who watch my channel know that the first thing I jump to is, nowadays, processed foods and all the other garbage in our environment. But you there presented information from decades ago when the United States wasn't in this toxic food environment. We used to eat real food, but yet there was a big discrepancy there. So that makes me think immediately there is definitely some other factor involved that probably isn't food related.
Yeah, these are multiple factors that are involved. But my thinking is, the more variables we can tick off, the better. So if iodine is a variable, and I don't think there's any question it is a variable in breast cancer and prostate cancer, if we made people iodine replete, and of course vitamin D is important in both of those as well, Definitely, the prostate is exquisitely vitamin D sensitive, as is breast tissue. Then, if these variables were taken account of, I think we'd find a massive reduction in the amount of these cancers. But also, we can then start looking for the more detailed causes that are causing the other cases as well. So, I've made a list here: control of metabolic rate, energy levels, weight management, brain function, cardiovascular health, fetal and child development, reduce stillbirths. That's an important one. Women that are very short in iodine, intrauterine death and abortion is more likely, as well as stillbirths. Infection is another important one. Iodine, of course. Remember when you were working in theatre and you prepare the skin and we just put poverty and iodine everywhere. Remember one surgeon saying to me, John, you can never get enough iodine. Slop it on everywhere.
Yeah.
And the reason for that is simple. Iodine kills all known viruses and bacteria.
Yeah.
So if you're iodine replete and you have adequate iodine circulating in the body, it makes sense that would kill.
Yeah, we're connecting the dots. Yeah, it does.
And anything that gets in. And the other thing is that the glandular tissue can accumulate iodine. Now, what seems to happen is that the thyroid gland has got first dibs on the iodine, as it were. So it can take it first because, of course, if you've got no thyroxine, you're going to, that's a life-threatening condition. But then iodine seems to be sequestered in these other glands as well. And it really makes you wonder if these other glands are very low on iodine because we're not getting much in our diet. Anyway, that's my background thinking on iodine. Having said that, let's go on to the main paper I wanted to talk about. Yeah. We'll put the links in as always.
Title there. Changes in dietary.
So, changes in dietary iodine explain increasing incidence of breast cancer with distant involvement in young women. And we always put all the links. So I've got my notes here and I've got the full. Do check on these links. Make sure we're not making things up. Now, just before we go on to the breast cancer, there doesn't seem to be any ambiguity at all that iodine deficiency is a cause of fibrocystic breast disease. And this is very common, particularly in young premenopausal women, cysts in the breast and areas of fibrous tissue. And apparently this affects up to 50% of premenopausal women. And it's very concerning because they'll feel a lump in the breast. And of course, that is very concerning. And giving iodine will result in resolution in most cases of fibrocystic breast disease.
Really?
And yet it remains common. Now, that seems well accepted in the literature. But of course, polycystic ovary syndrome is also very common. Now, I couldn't find much literature on that, but it really makes you wonder if fibrocystic breast disease is amenable to iodine treatment. Would fibrocystic ovaries be as well? But anyway, the fibrocystic breast disease is fairly conclusive that is related to iodine deficiency. Not all cases, but many cases.
And so, to clarify, you're talking about fibrocystic, not polycystic ovaries.
No,
which are different.
Yeah. Right. I'm not not familiar with So, is the fibrocystic ovary disease or polycystic ovary disease?
Did you say polycystic ovaries?
I think polycystic. So
okay, I misheard you. I thought you said
no, sorry, I may well have said it wrong. So let's clarify. Fibrocystic breast disease.
Breast disease, yeah,
for sure is iodine related. And you're right. I probably did say fibrocystic. I meant to say polycystic ovary disease. Thank you. So so this is where there's cysts in the ovaries and it has many adverse effects. Now, we're not saying iodine works for this. I couldn't find much literature on that, but lack of iodine seems to be associated with cyst formation around the body generally. So, and a cyst is a fluid-filled space. Now, I don't know physiologically what the link is there, but lack of iodine seems to be associated with more cyst formation. Being iodine replete seems to result in reduced amounts of cysts around the body. Not something you think of, but it's a correlation that epidemiologists have found. Now, I'm curious now, is there something called fibrocystic ovary disease? Probably not. It's probably just something I made up. There probably isn't.
I may have misheard you as well because it became fuzzy. So, yeah,
the viewers will be commenting now and replaying the video.
Yeah.
Yeah. Right. So, increasing incidence in breast cancer in younger women has been going on since the 1970s, and it often presents late. And this is data from the United States, which is very concerning. And iodine deficiency has been proposed by many authors to propose iodine deficiency can predispose to breast cancer, and people that are iodine replete perhaps get less breast cancer. And there's quite a bit of evidence to support that. And we looked at the Japanese women as a good example of that. And there's also some physiological evidence for this. In breast tissue and other tissues, there's something called the sodium iodine symporter on the cell membranes that will actually actively take in iodine. And iodine is also necessary for the expression of several hundred genes.
Oh, yeah.
So the normal functioning of the genome is somewhat iodine deficiency. So generally for breast cancer, now I think factors, and you probably know much more about this than I do, but factors involved in reducing the likelihood of breast cancer, generally. Vitamin D we know is important, and perhaps vitamin K2 with that. And particularly important in breast cancer is the cruciferous vegetables.
Yep,
so
strongly.
Cabbage, kale, garden cress, bok choy, broccoli, Brussels sprouts. Eat your greens, like your mother told you. And omega-3 seems to be a factor as well in breast cancer. So, and those ones, vitamin D is a common deficiency. Iodine, as we've seen, is a common deficiency. Many people don't eat as many omega-3s as perhaps they should, but vitamin D and iodine, common deficiencies. And we can't argue with the fact that prostate cancer and breast cancer are common diseases.
Oh, extremely common.
What is the link here? And again, this would be relatively easy to study. Could be an interventional study where millions of people are given iodine supplements, and there could be a trial there. Or what we could do, and I'm really hopeful for this sort of research in the United States with the changes in philosophy that are going on in leadership.
Common sense research.
We could look at the iodine levels in the urine of, this has been done to an extent, but we could do this. We could look at the iodine levels in the urine of 1 million people. And the people that had high iodine levels are going to have high levels of iodine in the body. People with low iodine levels in the urine are going to have less. And we could correlate that against a whole range of outcomes. And if you can do that with thousands or even millions of people, the data you can get is going to be really high quality there. So that really could be done. Yeah, now, I know one of your favourite questions, Sunil, is mechanisms of action. Is there a plausible mechanisms of action, how iodine could be working here to prevent breast cancer and distant breast cancer in young women? Well, it has an antioxidant effect. And antioxidants are good because it scavenges. Oxygen scavenges free radicals. We want to scavenge as many free radicals as we can. Just tell us what a free radical is, Sunil.
So free radicals are basically produced all the time in your body, a byproduct of all these millions, billions of chemical reactions that are going on. And the problem with free radicals is that they are implicated in many inflammatory processes, diseases, aging even. And there is a large body of evidence that to help sweep away these free radicals, the more antioxidants you have in your body, the more antioxidant compounds, whether that's through food or through other measures you take to improve your metabolic health, that's going to help clear the free radicals and lower your risk of disease.
Absolutely. And iodine is a well-known anti-inflammatory and immunomodulator. And as you've said, the immune system is absolutely vital in protecting us from early stages of cancer. And iodine, I didn't know this, but it promotes what we call differential apoptosis. Now, I'm sure you remember what apoptosis is. It's cell suicide.
Yeah.
So some cells will think, I tell you what, I'm just going to commit suicide. And they do, and that's for the benefit of the whole. So differential apoptosis would mean that apoptosis is more likely to occur in abnormal cells such as cancer cells, which of course is exactly what we want. Now, without getting too geeky here, this one's quite interesting. Iodine promotes P53 suppressor gene activity.
Okay.
So the P53 is what we call an oncosuppressor gene. It produces proteins that will do exactly that, prevent malignant cells from forming. So if iodine's promoting that, we've got more P53, we've got more suppression of tumours. It makes sense, at least in theory. Iodine is necessary for promoting, maintaining healthy breast tissue. Interesting one here. Women with goiter caused by iodine deficiency have 3 times more breast cancer than women that don't have an iodine deficiency goiter.
Wow, that's quite a statistic.
Yeah.
Incredible. 3 times.
Yep.
Wow.
Yep. Now, of course, goiter is severe iodine deficiency, but again, I find it fairly convincing. Now, iodine deficiency results in a hyper-responsiveness to estrogen. So if you lower an iodine, estrogen will have an even greater effect. And of course, if there's more estrogen, there's going to be more cell division in the breast tissue.
Yep.
And if the cells are dividing more than they should be, that gives more opportunity for mistakes to arise and abnormal cells to be forming. Iodine is necessary for breast remodeling during lactation and pregnancy. And this is also very interesting. Young women have less iodine in the urine than the equivalent young men.
Okay.
Meaning that young women are trying to retain more iodine.
Retain it more, yeah. I'm sure.
Now, I think the kidney can't, as far as I can understand this, can't retain all of the iodine. So it's always going to leak a little bit, I think. But it's actually quite good at reabsorbing quite a lot of it. So the fact that young women have lower amounts of iodine in the urine means that their kidneys are desperately trying to hang on to the iodine that they've got. And so-called atypia, anormal cells, is seen in animal studies, at least in animals that are that are iodine deficient. So quite a lot of things seem to hang together there. Now there's temporal changes. There's been a drop in urinary iodine in young women, as well as in the general population, since the 1970s. And this is the United States data. And this is from nutritional surveys. Now, if we just give an example here, the percentage of people with iodine deficiency. Now, people with iodine deficiency, this is defined as below 50 nanograms per litre. So a very low amount of iodine in the urine. A very low amount of iodine in the urine. So people with levels of iodine in the urine below 50 are very iodine deficient. Now, between 1971 and 1974 in the United States surveys, that amounted to 2.6% of the population. So 71 to 74, 2.6% of the population, very iodine deficiency with this low amount of iodine in the urine. By the time 1988 to 1994 had come along, this had gone up to 14.5% of the population in the United States.
What a change.
2.6 to 14.5. It's a 5.6-fold increase since the 1970s. And females had a higher frequency of iodine deficiency than men, almost double. Again, indicating that the ovaries and the breast are particularly iodine, like iodine, they try to retain as much iodine. And also, lower urinary iodine levels in black women relative to white women has been observed.
Interesting.
And sadly, young women have young black women have more breast cancer and presents late compared to white women. So black women in the United States present with more metastatic breast cancer than white women of the equivalent age. Now, another factor there springs to mind, which is vitamin D.
Yep, always the elephant in the room.
Yeah, and of course, the darker the colour of the skin, the less vitamin D that is produced. And it just seems inexplicable to me that our governments, and the UK is the same here, why we haven't got really clear guidelines about the lack of vitamin D in people with, well, in everyone, but the darker the skin, the greater the risk. And it just seems to me that governments are frightened to talk about this for maybe ideological reasons.
It's really bizarre, especially with what we saw during the pandemic, where there was a clear link between low vitamin D levels and propensity for a worse outcome. My other thought on that, John, I'd be curious to get your sort of insights onto this. Is there potentially any link between excess body fat, obesity, and inability of the body to absorb iodine? Is that plausible at all, or am I going sort of?
No, I don't think so. I mean, if we take vitamin D as an example, there we know that if someone's got excess adiposity, you could give a thin person 100,000 units of vitamin D, and the blood levels might start to go up in a few days. Give it to someone who's obese, and the blood levels might not change at all because vitamin D is fat soluble and goes into the blood.
Makes sense. Yeah.
So we know that people with obesity need a lot of topping up, that they could need huge amounts of vitamin D for a long, long time to top up the adipose tissue before the vitamin D goes from the fat soluble vitamin D is only once it's topped up the fat soluble tissue will it start going into the blood, where we need the 25-OH vitamin D. Now, iodine, as far as I understand it, is equally distributed throughout the body. So if people do have obesity, a lot of iodine will be sitting in the adipose tissue, not doing very much where it's not needed. So my understanding, and it is only my understanding, is that yes, it's true to some extent, but not true to the same extent as it would be with vitamin D, which is exclusively fat soluble. But yes, would they need somewhat more? Yes, I believe they would need somewhat more.
That's very interesting, especially with trends we're seeing in the Western world.
Yep, indeed. Now, the data for 2005 to 2008 is less clear, but if we take a higher level of iodine in the urine, what the World Health Organization would be the lower level of what's acceptable, we actually find, and this is really quite incredible, 56.9 had levels less than the WHO recommendations.
Goodness.
And this is just the WHO, which we have our critiques of.
Well over half.
Yeah. So the WHO recommendation is for 150 to 249 micrograms a litre of iodine. And of course, remember, the less iodine in the urine, the lower the levels of iodine in the body. So this would tell me that 56.9% of the American population potentially have suboptimal levels of iodine.
By now. Yeah.
Absolutely quite incredible. So we've gone up from 2.6 to 14.5 to over half.
Yeah, that is incredible, especially as large segments of the US population do live near the coast.
Yep.
Less live inland.
Yes, but how many of those are eating fish and seaweed, of course, would be the key thing.
Yeah, so they moved away.
I'm not sure the farmers take a lot of cartloads of seaweed onto the soil anymore. And this is part of the problem.
Yeah.
The soils that did have iodine, it's degraded over the generations. And you replace it with artificial fertilizer, which very often, in fact, I don't think any of it contains iodine that I'm aware of. So the soils become progressively depleted. So we've got this risk of breast cancer, and we've also got this neurocognitive impairments. Now, is there an increase in neurocognitive impairment in our children? Well, we know there's much more ADHD than there used to be.
Yeah, there's definitely a lot more issues, without any doubt.
More autism.
When it comes to, mental health.
Now, vaccination may be a factor in this, but is iodine deficiency also a factor? And so some of the things that we're seeing now, when I was young, there was no such thing as transgenderism. Simply didn't exist.
You probably called it something else. We won't go there, but
There was. I mean, there's always been some genuine biological.
Yeah, exactly variation, but nowhere near to where it is now.
It wasn't in the popular mind.
Yeah,
of course, pediatricians would have known about it.
Yeah, I mean, we learnt about it as a footnote in our medical school. That wasn't that long ago, but now I expect they probably got whole days or weeks devoted to the phenomenon.
I'm not saying there's, it just makes you wonder. There's a lot of...
Well, it makes you wonder, and it also, there's another term I really like as well, which I'm thankful that is being bandied around more, but that is hormonal disruption as a result of all of these factors. I mean, we could talk about environmental factors that cause hormonal disruption, but I'm sure, I mean, iodine is linked to the thyroid. That's probably the ultimate hormone disruptor right there.
Well, iodine is, in ways I don't fully understand, involved in all glandular tissue.
Yeah, exactly.
Both endocrine and exocrine. So, interesting questions there. Now, in 2013, there was an article in The Lancet, 2013, and it said this: iodine deficiency in pregnant women in the UK should be treated as an important public health issue that needs attention. 2013. As far as I know, I haven't heard of any changes in guidelines since then.
Well, we know our authorities, they don't like to focus on what we call low-hanging fruit. Their minds are elsewhere. So vitamin D, iodine, no interest. And isn't it interesting, a few decades ago, this was what public health was all about. Get enough iodine, get enough vitamin D, get up and move.
Yep.
Unfortunately, that's not our current medical paradigm right now, is it? We've already talked about that before.
Now, there's another twist to this story, Neil. The halogens, as we've said, group 7 of the periodic table. So there's 2 radioactive ones and 4 that aren't: fluorine, chlorine, bromine, and iodine. Now, the thing about these is, because remember I drank this and I said it tastes a bit like swimming pool, which of course contains chlorine, because it's in the same group in the periodic table. So bromine, fluorine, and iodine exhibit what we call competitive inhibition. They are competing for the same parts of the body. Now, flour, for example, in the United States used to contain iodine.
Yeah, I've heard that said, yeah.
That now apparently has been replaced with bromine.
Yeah, interesting. And tons of sugar, probably.
Indeed, yeah. So, bromine, most common sources are pesticides, plastic packaging, drugs, soft drinks, baked products. Bromine now added to flour in the United States, whereas iodine was added prior to the 1980s. And we know that this iodine reduction has occurred in the United States during that time. Now, bromine, which is added to flour in the United States, is a suspected carcinogen. So, can someone explain to me why a really useful element like iodine has been taken out of bread and bromine has been put into it when it's a suspected carcinogen? And there's brominated flour and there's also brominated vegetable oils. They're banned in Canada and the European Union, but still used in the United States. Now, so what we have in a situation now, anyone that eats bread in the States, they're now getting less iodine and more bromine. But the bromine is competing for the place that the iodine would have taken. So you could end up with bromine in your thyroid gland instead of iodine.
Awful.
Fluorine, and of course we know about the debate about fluorine in water. Fluorine, now bromine, as far as I know, the body doesn't need any bromine at all, but fluorine, it needs an incy-wincy tiny amount, very small amount, but we're getting arguably much more than we need. So fluorine will displace iodine in the body. So if there's fluorine in the water, that can deplete iodine levels, adding to the lack of iodine. And these are also, the fluorine and the bromine are in a lot of other things, fire retardants, for example, as well. So there's a lot of reasons why iodine deficiency is there. And it's not just the lack of iodine itself, it's the excess of these other halogens that we're exposed to.
Yeah.
So in conclusion, sorry?
All very concerning.
Yeah, and it does kind of tie together. So in conclusion, dietary iodine insufficiency represents a plausible explanation for the increased incidence of breast cancer in young women with distant metastases, according to the author. Based on the importance of iodine in thyroid and breast cancer, fetal brain development, as well as deficits in nutritional trends in younger women, iodine testing and management may be considered as a potentially important aspect for clinical practice.
There you go. Where was the study done?
This was all over the United States based on nutritional surveys in the United States during those periods of time that we talked about.
Okay. Wow.
And it's published in Journal of Cancer.
Yep. And you hardly hear this talked about.
Now, in the UK, we don't add, as far as I know, we don't add bromine to flour, but we certainly don't get much iodine in the diet. And you read a lot about potential iodine toxicity, which I'm not going to discuss in detail, but as you've seen, I've just taken, and I take that most days.
Yeah. And that is, I saw John put iodine in it. It's not a tequila shot.
It wasn't. It tasted like swimming pool.
Yeah, it is. Yeah, exactly. We saw that, and there it goes. And actually, that's a great segue. You're probably going to get to this, but I'm going to ask the question.
No, please.
What's the best way to take iodine? You got supplement there, but if somebody wanted to do it diet-wise, is that even feasible?
Yes, it is. Absolutely.
Yeah.
Now, anything that comes out of the ocean will contain some iodine. Or even foods that are grown close to the ocean will contain some iodine, but we've no way to know that. Now, the amount of iodine in fish does vary quite considerably. But sardines contain quite a bit, and cod and haddock, the more common fish, well, when we can get them in the UK, contain reasonable amounts of iodine. Other fish, surprisingly, actually don't contain that much iodine. From memory, sole and plaice are actually quite low in iodine, which is surprising. But what is shellfish, of course, contain reasonable amounts. Any ocean shellfish. But what is particularly high, way higher than in fish, is seaweed. And of course, we just don't eat seaweed. Is not really part of the English culture.
It's not.
Now you get soda bread in some. What about the States? Is seaweed eating?
Yeah. So funny enough, I mean, the times where I eat seaweed, we almost always order it when we're ordering Asian food, Chinese food. We get crispy seaweed. I actually love that. But the question is, when they use that, I'm sure they don't cook in the best way. It's very tasty, but do they deplete the iodine? Have you got to eat it raw, presumably, to get the best?
A lot of the iodine will go out into the water that you cook it in. So kelp salad with uncooked kelp, clean uncooked kelp, is probably the richest source of iodine. And as I said, though, I was eating some from a Japanese outlet. And I just thought I'd check, and I reckoned it was about 12 milligrams of iodine in the portion of kelp that I was eating. You know that seaweed they wrap sushi in?
Yeah.
Don't you recall? That contains less.
Okay.
Some, but less. But kelp is a particularly high source of iodine. And kelp, of course, is grown in huge amounts in Korea, where they also have very low amounts of breast cancer, and Japan. So we need to eat more seaweed. And as far as I know, don't go and pick seaweed based on what I say now, but as far as I know, at least in the UK, no seaweeds that you can grow in the intertidal zone are poisonous. I think there is one that grows out at sea.
Pick them up and eat them.
I'm not recommending people do that because I don't know enough about it. But my understanding is that you can eat pretty well. Or some, of course, are too fibrous to eat. But, we need to learn about seaweed, we need to eat more seaweed, and we need to cultivate it. And also, and this is another one of my hobby horses, really, we need to grow more marine plankton, the microplants.
We touched on this last time, yeah.
And the reason for that is twofold. One, it will contain the iodine from the sea, but also it contains the omega-3s. They're so important to health because the fish don't make the omega-3s. It's the marine phytoplankton that actually make the omega-3s. Now, other things are interesting. For skin infections, of course, we know that iodine is excellent. Some iodine will be absorbed through the skin. And whenever I get a cold now, I gargle with iodine solution.
Okay, and you can just buy that over the counter?
Just Lugo's iodine.
I'm
glad you brought that up. In the United Kingdom, pharmacists are not allowed to sell Lugo's iodine over the counter.
Oh, okay.
The most basic drug in the history of medicine, perhaps, or if ye know not the where, when, and why, give ye then the K and I.
But you think what else they sell over the counter? So do you have to get it online? Or
I had to get it online. I've got a couple of bottles.
Wow.
You got to get it online. It's not expensive, and there, in that bottle there, that's what it's at 100 mils. You've probably got a lifetime supply for you and your whole family there.
Wow.
The amount you need is so tiny.
Is it from the UK?
This is from the UK, yeah.
UK, okay. And
but you get it everywhere. The Lugo's iodine tends to come in 2%, 5%, and 15%. The 15% is the strongest.
And it's always as a liquid. Could you also do a tablet?
The Lugo's iodine is available in tablets.
Interesting. Okay.
In capsules. Now, I actually looked this up. You can buy on Amazon capsules of Lugo's iodine in capsule form that contain, I think it was 12.5 milligrams of iodine, of Lugo's iodine. And there's the two different types of iodine in this means it's particularly well absorbed. Dr. Lugo was a smart guy. He had it all worked out.
Sounds it.
But back in the 1820s. And those capsules on Amazon, 125 milligrams. Sorry, 12.5 milligrams. It said take one capsule every 125 days.
That's it. Wow.
Which works out at 100 micrograms a day.
You don't really need much.
Well, no, I think that's the drug. I think that's their way of covering themselves.
Oh, okay. Right. Interesting.
Yeah. So I'm the dose of iodine is a bit of a nightmare. I'm not commenting on it, but currently, I might have told you that I'm not keeping a secret. I'm trying to get my PSA down at the moment.
Yeah.
And iodine is one of the strategies. I'm vitamin D and iodine and zinc.
Right, it's all plausible. You're thinking logically.
They won't do any harm. So that's I've talked to people that actually take more iodine. Of course, I can't recommend what anyone else takes, but I've kind of got used to it.
Yeah, everyone should do their own research, as with anything we talk about. And these are all natural substances, and it's one of the first things. I mean, let alone medical school. I remember elementary school and early grammar school, all those lectures on how important iodine was for our health. And we seem to have forgotten these things. I wonder if you talk to young people nowadays, whether they have the same knowledge of these basic things.
I know.
It's sad. It's truly sad.
Really, these things should be taught in school. How do you grow green vegetables?
Yeah, don't know this.
These basic things really should be taught. So I've just taken 12 milligrams of iodine in the course of this conversation, and the reason I've taken that is that's the same I will get in a dose of kelp salad.
Makes sense.
Now, of course, I'm not advising people what to take because there is such a thing as iodine toxicity. But if for me, I think if I am iodine-replete, which I don't think I am because I haven't been taking it for that long, but if I am, I'll excrete 90% of that in the next 24, 48 hours.
Yeah, and that's actually my next question. If anyone out there thinks, well, I want to know whether I'm iodine deficient, what's the best way to do that? I can imagine it being a nightmare in the UK to get tested. In the US, you definitely find somewhere that you can pay to test. I don't know whether a routine doctor will be able to test for it within insurance. But what's it like in the UK?
Non-existent, I would say.
It's non-existent.
I have talked to private doctors who do it.
Yeah.
So I've talked to private doctors who do test it. Now, testing blood levels for iodine is difficult biochemically for reasons I don't fully understand. But the doctors that work with iodine don't go on blood levels, they go on urine levels. So talking to doctors that do give iodine as part of their practice, the private ones that can do this, I've never, in all my years working in the NHS, I've never seen urinary iodine ordered.
I don't think I've seen it in the US either.
In 45 years, I've never seen a patient have urinary iodine assays ordered. Never seen that. But apparently what happens is women are put on iodine to prevent breast cancer. And if you give them iodine to begin with, they'll excrete a relatively small amount of that dose. Maybe excrete 10% of that dose. But then over time, and I'm being deliberately vague here because I don't fully understand the details, but over time, they'll start excreting more and more of that iodine.
I see.
So the only way really is to measure the urinary levels of iodine. Now, that test is pretty easy to do, but that's really the only way to do it. Now, I have heard a couple of doctors on the internet saying that you can put some iodine on your skin and see how quickly it's absorbed, but I don't know of any evidence for that.
Yeah, I can imagine that being a very hard thing to.
It doesn't really make any sense to me. Having said that, I'm open to evidence, but so the answer is, what I would do if someone came to me and said, "John, I'm worried about iodine deficiency," I would say, right, okay, tell me about your diet. Do you ever eat seaweed? How much fish do you eat? Do you eat shellfish? Do you live near the sea? Do the crops that you eat grow on land that is near the sea? And, when you find that the answer to all those questions is no, I might have fish and chips on a Friday, but I never eat. Most people in this country never eat seaweed. Most never eat seaweed at all. So they eat some fish, and in the United States, some iodine is in the salt, but in the UK, we don't put iodine in most. You can buy iodized salt, but most salt doesn't contain iodine. To me, the history would indicate that most people coming to me with that kind of report would be low on iodine. And so what I would do is call on regulators and all governments around the world. Okay, we can talk about RDAs. Maybe we should change that to minimum daily requirement. And we should have something called the optimum intake.
That would make sense, yeah.
What is the optimum intake of iodine for the average person? Now, we know the minimum RDA. It's probably about 150 micrograms per day. But we don't know the optimum RDA because it's not published.
Yep, not well known at all. And it's
And
such a crucial element.
I think it should be. And I'm not in a position to give it because we can't prescribe a particular amount, unfortunately. We can't prescribe on this program. So there we are. We're in a rather unsatisfactory situation.
We are, and you're thinking this day and age. Yeah.
Iodine deficiency may be lowering the global IQ by 5 to 10%, and we simply don't know.
Yeah, we need more evidence. And even I'm thinking evolutionary. I mean, we came from the sea, if you go back far enough. So there is a definite link there into these compounds that we need to function.
The omega-3 and the iodine, as far as I know, all. I don't know. I mean, you must get bacteria living in mountain lakes in the Himalayas. I really don't know how they function without iodine, or essentially maybe they have tiny incy-wincy amounts. I don't know, but
yeah, or large segments of the world which are vegetarian. For instance, in India, they must be getting it from somewhere because they don't eat seafood.
Interesting.
There must be another way that they are being fed iodine because they wouldn't be able to function otherwise.
They wouldn't. They couldn't be born without iodine.
Yeah. So
there must be some. But my argument would be that with the intensive agriculture, if take India for example, fairly intensive agriculture has been going on in India now for a couple of generations. Now, if we go back to, I don't know when the last famine was in India, probably about the 1950s. Do you know?
Yeah, around then. Yeah, I would think 50s. Yeah,
and that was largely taken away by the addition of fertilizers, which have been revolutionary. But you put fertilizers on, the crops grow, and if you don't add the iodine, then the iodine that's in the soil will be taken by those crops. But then you put on some more nitrogen-based fertilizers next year, and the crops grow nicely because they contain nitrogen. But that next year of crops will contain even less iodine because there's even less in the soil.
Yeah, so it's a vicious circle.
So I suspect the iodine in Indian soils is going down year on year.
Yeah.
And that means any
sense.
iodine that is in the plants in India is probably also going down year on year. So I suspect the amount of iodine is going down in the people is going down as well. And, as we said, we know a third of the population doesn't have enough iodine. This is probably a global problem.
Basic amount, yeah.
And it's one that I feel governments should address urgently because it's involved in so many aspects of health.
Yeah. And I could imagine with the current scenario and politically, if it's going to happen in a country, the US is probably best placed to address this as a root cause issue.
Yeah. But to me, they're the two big nutritional problems. The vitamin D and the iodine are the ones that we're very likely to be short of. And we've seen that these work together in breast cancer and prostate cancer, for example. So other diseases potentially. So there we are.
That all makes complete sense. Yeah.
Yep,
no, thank you for that, John. That was
iodine.
fascinating. I've learned something as well. I'm going to read up and last time I ended up taking what you presented to me. I think I might do the same. That was flaxseed last time.
Yeah.
But yeah, I mean, I've heard things over the years. I've read superficial reports, but this has been a very detailed analysis. So thank you for that. I've benefited. I'm sure many viewers have as well from this discussion.
The flax seeds are unambiguous. I mean, we can happily say eat more flax seeds than it's a food.
Yeah.
We can give advice on that. And I can happily say, seaweed, eat seaweed. It's a food. What we can't really recommend specifically in any specific way is things like iodine and vitamin D because they're supplements. It's harder to
exactly.
We can't give specific advice on those, which I know is frustrating. But
we can say do your own research. It's all out there. You've seen what John does. I will talk very openly and freely about what I do. Last time it was the cup of blueberries every day, and that's something that anybody can do. But everybody should go and do their own research into this. And you're often surprised, like you might think that iodine should be a very basic thing that we all know about. And you simply go online and you realize, wow, I did not realize that. And I didn't see that statistic. Maybe I will make a change. Have a discussion with your doctor if you want as well. But that's what we want. We want people to be armed with new knowledge that they're certainly, definitely not getting from the mainstream, because the mainstream, we know what they focus on, and it isn't things like iodine or vitamin D, sadly.
Yep. So ask your doctor about iodine next time you go. Ask your doctor next time you go to about iodine and vitamin D and see what he says.
Yeah, during your 3-minute appointment.
Yep. Maybe not a lot will be the answer, but you can always ask.
Tell them that's the purpose of the appointment, but one has to take charge of their own health.
Yep, absolutely. Yep. Great. Right, your turn next, Sunil.
Look forward to it. We'll speak again really soon in this natural medicine series.
I will remain curious as to what it is, but when it's ready, let me know and we'll do it. It's absolutely great fun. So lots you could do, but we'll just have to wait and see, won't we?
Yes,
we'll just have to wait and see.
We'll speak soon.
I won't know what he's going to do till you know. So we'll know at exactly the same time.
Perfect. Okay, thanks everyone for watching.
Yeah, thanks everyone for watching. Yeah. All right. Bye-bye.